Hello, my name is Todd Hutchison, and in this session I'll introduce you to the International Institute of Medical Project Management's 4-phase Medical Project Management Framework. This framework can be used to explain the project lifecycle and the key elements that guide all health and medical projects, and sets a context to the operating environment you are working in. This provides a guide for any health or medical project, from undertaking research, building a new clinic, creating a new medication, commissioning a new health information system, and through to establishing a new process. The first part of the Medical Project Management Framework is to recognise that medical and health-related project environments have a uniqueness in that they need to consider the high privacy of patient medical records, and of course the wider confidentiality of the organisation's information that is governed by national laws, policies and the general public's expectations. The framework also recognises the external forces that apply, that includes legislation and regulations, the need to consider decisions in the light of public health interests, and other commercial factors linked to running the organisation, funding it, and of course its sustainability. The 4-phase life cycle of initiation, planning, execution and closeout is highlighted, with its key elements being promoted in detail to emphasise the focal points of each stage. Let's look at the initiation phase. Well, firstly is to work out who is the project manager working for. This is called the project sponsor. This is an individual, and then they have to state their name. They're normally the executive in the organisation and often in charge of the portfolio that the project manager is working for. In fact, that's the easiest way to work out who they are. You try and work out, well, which department or which area are we talking about for this particular project, and whoever's in charge of that area typically is the project sponsor. Clearly, if it's the whole organisation, such as a hospital, you've got to look at the theme. The theme could be around risk or safety. Then we look at who's the executive that's in charge of risk and safety. The easiest way to end up to identify if you've got exactly the right person is ask this question. If we have to cancel this project, do you have that authority? If they say yes, clearly they are the project sponsor, because only the project sponsor can approve and cancel the project. If they say no and they mention someone else, well, they're effectively talking about who is the real project sponsor. The project sponsor approves all the plans and any changes to the plans. The next element is the scope definition. Scope means all the outputs to the project, which we call deliverables, but also all the work we have to do to create those deliverables. This is where a lot of things go wrong, because when I go into a project and there's a lot of challenges, it's because the scope was not well defined. Imagine if I got 20 people and said, I just want to get the history of this particular hospital. All I want you to do is go back, look at the history and give me a document about the history of this hospital. But when you look at it, when I'm going to get 20 people and they run off because they think they're clear on what they're needing to do, they haven't actually asked, do I want the history of who the executives were, or the history of the funders, or the history of the departments. They haven't been clear enough in their scope, and therefore I'm typically going to get 20 different reports back. This is where a lot of projects go wrong, so you have to be very specific with the scope. We also have to identify, through identifying that scope, what's the indicative budget and the indicative schedule for this project. Now, the project objectives is what the project's trying to achieve. This is the bigger picture. We want a new hospital with at least this many wards. Now, therefore, the architect can take that objective and actually start creating the deliverables that will meet that objective. That means the objectives are typically set by the project sponsor, but the deliverables go about explaining how they fulfill those objectives. Now, in addition to objectives that have to be completed during the project life cycle, we have benefits. Benefits is when the project deliverables are handed over and they start using those to see the benefits. That means it's not in the project life cycle, but it's in the operations life cycle. In addition to that, we have to identify, well, is there any assumptions that if we've got wrong, this whole project plan could be wrong. So assumptions are things that we deem to be real or truth, that if we've got wrong, the whole project plan is wrong. That means we don't have a lot of them, but we write those key things that would impact the actual accuracy of the project plan. Now, the other thing we have to consider is constraints. Now, constraints are restrictions or boundaries that impact both the planning and the execution of the project. That's why when we say, is the budget a constraint? Not really in this context, unless they said you've got only $100,000 to go and do this project. So they've set a boundary of $100,000 that is now going to impact my planning and execution. And the last thing to note in the initiation phase, where we typically have the document called the project proposal or some form of business case, is that in that project proposal there are options. We might say the project could be done this way or this way or this way, but we then recommend one of those options. This is quite important because sometimes you'll go back and ask, well, why did we do it that way? And the answer is back in looking at what were the options and why we chose that particular one. When you look at it, all that information gets carried to the next phase but goes into more detail. But the options do not. We only take the one that is recommended and accepted by the project sponsor. In the planning phase, we already know who the project sponsor is, but we now define who the project manager will be. Ideally, it was the same person that's been working on the project proposal. We have to identify who exactly are going to be the project team members. These can include both staff or internal human resources, as well as external human resources. We then may require a steering committee. A steering committee are typically executive people with political power. Generally, I only need a steering committee if I come under one of three general conditions. Firstly, if it's across the whole organisation. Say for example, if I was going to go across a whole organisation that had many departments, I might get each department head to be a member of the steering committee. That means when I go to the steering committee and I actually are talking about an issue with a particular department, the head of that department is there. They'll typically say, oh, that's my department, I'll take care of it. And that's called peer group pressure that actually works for the project. There is also the scenario where you've got a joint venture and all the joint venture parties want to be making a decision. So we put them in the steering committee, of which then the project sponsor is the chair of the steering committee, so it brings it back down to the rule of only having one project sponsor. And the third option is if it's highly political. Now, if it's highly political, we need to identify who has the political power and bring them on the steering committee. That usually means that when they're on the steering committee, their reputation is tied to the project, so they're more keen to make it work. In addition to that, I can have the option of having one or more advisory groups. Typically, we don't want too many because they take an administration effort anyway. But an advisory group is a group that provides input, feedback and guidance. As the steering committee reports to the project sponsor as an advisory group, the advisory group reports into the project team. And therefore, if there is any challenges with that input, feedback or guidance, it basically gets isolated within the project group. In the planning phase, we now take that indicative budget into a detailed budget. This means it's going to be very accurate, and that's what's going to be the basis of getting funding. We also have the detailed schedule. And of course, any quality metrics that we know what's the acceptance criteria of the quality of the deliverables that we'll deliver at the end of the project. Now, this creates in this phase the project management plan. The project management plan may have a number of subsidiary plans depending on if the project is simple or complex. Some of these subsidiary plans would include the risk management plan, the communications management plan, the work breakdown structure, the budget, the human resource plan. In fact, all these things we plan. In fact, if you ask me the question, how many plans are there in project management? The answer is one, and that's the project management plan. But all the other things that have the term plan in it are actually called subsidiary, which means they're appendixes to the main plan, which is the project management plan. These cover the key areas that we want you to focus on during the planning phase, which therefore produces the project management plan. And of course, there may be more than one template for project management plans in your organisation, so you only go down to the level of rigour required. That means you may have one for minor or simple projects compared to one for major or complex projects. Now, clearly, the one for major or complex projects is going to have all the subsidiary plans. This allows us to only go down to the level of detail that's really warranted to get the right rigour for the success of the project. The next phase is the execution phase. This is where we take the project management plan and particularly the activities and tasks that are listed in a tool called the work breakdown structure, and we then execute those tasks. We monitor them by looking at the percentage complete, and we actually control the project to make sure it's going to deliver on time and within budget, and of course to the quality level. This requires us to have progress reporting, but also to manage the risks that we identified in the planning phase, of which we may have created some risk treatments for. We then put those risk treatments in the terms of a risk register, and we actually then make sure we do them. Of course, risks can also change over the project lifecycle, so we're always looking at and checking in, are there any key risks that could be slowing down, stopping, or hurting the project? Now, when a risk gets realised and it has a negative outcome, or other things that may happen that cause us problems, we call these issues, and is managed with the issues register under the process of issues management. And of course, while you're there, can you do this? I'm thinking about doing this. Anytime someone comes along and proposes a change, we run the change management process. We have the change request. So when they ask for a change, we can pull out and work out what is the change and the justification. And then we actually look at what's the impacts on the schedule, the budget, etc. Then go back to the project sponsor and make a recommendation. This avoids something called project scope creep. Now, scope creep is something we definitely don't want to do, because you start with a small, nice project, but then it becomes the Ben-Hur of all projects and no one's giving you any more budget or schedule. We stop all that, because as soon as someone says, while you're there, can I do this, what about this, or have any ideas, we manage that through the change management process. This allows us to therefore manage risks, progress the work, deal with issues and any changes that come up during the execution phase. The last phase is the closeout phase. This is effectively where we're handing over the deliverables or the outputs of the project, and we have to evaluate it to something called the triple constraint. Did you deliver to the cost or the budget? Did you deliver to the schedule or the time? And did you deliver to the quality or the specifications or the scope that's been promised? That's the quality check. We also have to discharge any financial elements, which are things we have to pay or money we may have had to get. And we should sit down, particularly on those complex projects, to look at and consider, what do we learn, what do we do good, and what do we do bad that we would recommend in the future of different ways of operating. This allows us to continuously improve. Of course, this is where the team gets disbanded or reassigned to other projects or back to their operations roles. This is an important part of it, because the adjourning part of a team development says that we should really recognise the achievements that we've got. And if it's a complex project, we should get off and stop, have a cake, a coffee or a drink, and just celebrate what we've actually achieved. That's a good way to bring things to a closure, to stop us in this absolute fast-paced world, to just break for a moment, get off that hamster wheel, as I call it, and look back and say, wow, look at what we've achieved. That sense of achievement, that moment there, will make you feel like you're actually doing well and brings the team closer. And of course, all that information is then archived. And because it has a financial basis, under Australian law, for example, we have to keep them for at least 7 years, those records. That basically sums up the closeout of the project. Now, the methodology is also supported by a number of defined productivity tools and enabling processes and approaches that include, firstly, the patient experience. That is the user experience between the patient and the medical or health service they are engaged. We talk about this word user experience. It says basically, think of all the users to the system, which include the actual medical and health personnel, the client and any vendor or supplier to the project. If everyone is enjoying themselves, then you can see you've got a very strong culture. So this concept of focusing on the patient experience, but how it interacts with the others, makes it very important to actually build a culture and an experience that people have actually enjoyed. Secondly, the use of agile project management methods. Now, the International Institute of Medical Project Management has agile methodology. That is a separate way of doing projects, because it reflects more of the agile systems, that instead of planning a project as we do traditionally and then executing it, it actually plans it in stages, or what we call cycles, or in the Scrum methodology we call sprints, one at a time. So we're defining just exactly what is the scope for that next sprint. And it delivers projects in cycles with the intent that every time at the end of a sprint, it gives something of value. This is just a different way to do projects, and is it a way to start projects where the scope is not well defined. You might have to look at that training to better understand the differences between our traditional methods and that of Agile, because certain projects are better in either or, than actually trying to just use one method. Thirdly, there is workflow processes that reflects the use of process to guide behaviour, and design technology and manual work system interactions, so the way we work actually helps get things done. Fourthly, there is templates, which is the methodology or toolbox of project templates that we provide as part of the Institute that guide the appropriate collection, amalgamation and presentation of records and information. And lastly, there is technology that reflects the use of technology and the integration of systems and automation that even extends to the potential use of artificial intelligence systems. The framework also acknowledges the interactions of people and the influence of politics and the capability of the organisation, including its constraints, recognising, firstly, leadership, where there is the need for strong decision making and direction setting. I call this clarity. Clarity is king. Then there's the interpersonal skills. There is a need for high skills of engagement, communication and key stakeholder management. Then consideration to the medical and health service culture, where there is a need for a healthy organisational culture that leads to positive workplaces and great service delivery. And lastly, organisational capability that reflects on the ability for organisations having the right capabilities to deliver consistently to the current and future needs of its client base. Altogether, this presents the key elements that accumulatively support the planning and execution of successful projects. This framework is used to provide some consistency on how health and medical projects are approached. The International Institute of Medical Project Management is keen to see the time and financial investment into health and medical services has a real impact. And this all starts with recognising that anything new or unique is actually a project. All the organisation's plans that make up its strategy are executed through projects, and therefore everything we have in any research, clinical or public health system today started as a project. We want to help you be better at what you do to improve the total outcomes of healthcare worldwide.